If you remember, the World Health Organization has twice declared a public health emergency of international concern for Ebola in 2014 and again in 2019, when the virus surfaced in the Democratic Republic of Congo. With no treatment at hand, it was largely controlled through several vaccines and public health measures. The vaccines and treatments approved for Ebola target the Zaire species, the primary source of previous outbreaks. But they are ineffective against the Sudan species now circulating in Uganda. East African nation Uganda is currently in the midst of the 5th outbreak of the rare deadly Ebola virus. On Sunday, the health authority reported about 58 new Ebola cases that has been recorded, out of which 19 people have died, though the figures may be slightly higher than what is showcased. Uganda President has declared a 3-week-long lockdown in Mubende and Kassanda districts in the country in order to limit the spread of the virus. Ugandan Health Authorities declared an outbreak of Ebola virus strain in the country in September. What is Ebola virus disease? How do people become infected by Ebola virus? Is there a vaccine against Ebola virus disease? Let's try to understand these aspects in today's video.
Ebola cases continue to rise in Uganda. The country has since recorded 63 cases and 29 people have died, including healthcare workers. Ebola spreads through body fluids and has a high mortality rate. The Ugandan outbreak is caused by a Sudanese strain of the virus, and the race is on to find an effective vaccine.
The case of the relatively rare Sudan strain was confirmed by the Ugandan Virus Research Institute. The World Health Organization also said in a statement, now the East African country last reported an outbreak of the strain in 2012.
Ebola is a virus that causes problems with how your blood clots. It is known as a hemorrhagic fever virus because the clotting problems lead to internal bleeding, as blood leaks from the small blood vessels in your body. The virus also causes inflammation and tissue damage. People become infected with Ebola either through contact with infected animals, usually following butchering, cooking or eating, or through contact with the body fluids of infected humans. Most cases are caused by human-to-human transmission, which occur when blood or other bodily fluids or secretions such as stool, urine, saliva, semen of the infected people enters a healthy person's body through broken skin or mucous membranes. Infection can also occur if the broken skin or the mucous membrane of a healthy person comes in contact with items or environments contaminated with the body fluids from an infected person. These may include soiled clothing, bed linen, gloves, protective equipment and medical waste such as used hypodermic syringes. Currently, there are 2 licensed Ebola vaccines. However, the exact level of protection provided by the vaccine regimen is not yet fully known. Supportive care, rehydration with oral or intravenous fluids, and treatment of specific symptoms improves survival. There is a yet no proven treatment available for Ebola virus disease. As a conclusion, I would like to mention that people can protect themselves from infection with Ebola virus by following specific infection prevention and control measures. These include hand washing, maintaining proper hygiene, avoiding contact with bodily fluids of individuals who are suspected of or confirmed to have Ebola. Thanks for watching.